dental x-rays tied to a certain type of brain tumor? This is according to findings that were published in the American Cancer Society journal Cancer. Those tumors are non-cancerous but debilitating according to this article. Now, when this news came out, understandably, the phones at dentist's office all over started ringing off the hook. Dr. James Sanderson, Jr. is a dentist, and he is with us this morning. Good morning. Good to see you.
Good morning. Good to see you.
We were just saying that oftentimes when studies are done and the research is released, it does get people concerned when a lot of times there's not that great a need for concern, and you say that's what we're looking at here.
And I think so. I mean, yes, radiation, any radiation, you want to be concerned about. But, you know, the radiation that we're using today is 90% less than what we were using when I got out of dental school in 1984.
All right, you, and this is part of the survey, you said, in fact, let's look at, it takes 50 millisieverts, okay, before you have an increased risk of cancer.
Yes.
When you get a typical x-ray, you're getting 0.005
to 0.03 millisieverts.
So you're not even in that category of even increased.
You're not in the category. You're not anywhere near where you have a problem.
So, in fact, part of the survey, and it even states in this survey here, that we're talking about things way in the past, the way x-rays used to be done.
Right. When we had film radiography and we had large amounts of radiation that we were using to try to do that, then you had a lot more radiation than you do today.
You can't do your dental work without doing x-rays, though.
If you don't have x-rays, you're only getting 30 to 40% of what you need to be able to see.
And from what the survey says, and then the bottom line is, and you showed me this here, it's a conclusion for this study, and it says exposure to some dental x-rays performed in the past when radiation exposure was greater than in the current era appears to be what's associated with this. So the bottom line for you is what?
Talk to your dentist. Ask your dentist what they need to know. You know, why are you taking this x-ray? Okay, if they've got a good reason for taking the x-ray, take the x-ray.
Because most of the times, if you go to the dentist regularly, most people, if they are on a schedule, they go every 6 months or so.
Right.
So the most you would have was 2 times a year to get an x-ray.
Generally, yes.
And if your patient says to you, Doctor, I heard about this study that was released, I'm concerned about this, what are you telling your patients?
I'm going to talk about how many millisieverts it takes to have a problem and how many millisieverts we're going to use, and it's their body. You know, it's their choice to decide, do you want for me to have this information that I need to take the x-ray, or do you not want me to have it?
But you have no concern about the way x-rays are done today.
I have no concern about the way x-rays are done today.
Were you surprised when the study came out and people started reacting the way they did?
I thought it was, yes, I was very surprised.
And what was your first reaction to it?
I can't believe I hadn't heard anything from the ADA or anybody else that this was coming, and the ADA didn't know it was coming either. So
this just came out in the Cancer Journal, and it surprised dentists all over the country.
And the Cancer Journal is generally a good journal.
Right.
I mean, everybody involved in this is generally good people, but I think this one just sort of...
And the thing is, you're not saying this is not factual. You're just saying that you really got to dig deep into this study to see what we're talking about.
It's a great opportunity. You know, there's 6,500 people in a year that will have the meningiomas. There's 40,000 people that are going to have oral cancer this year. Go to your dentist.
Go to the dentist. All right, and again, like he said, the bottom line is if you've heard about this study and you're concerned, just talk to your dentist about it. But from what experts are telling us, it's really not what on the outset of the study looked like. So that's good news. Good to see you.
Good to see you.
Thanks for coming by.
Thank you very much.
All right, let's check in with Nick.